Let's talk about the CDC, the Centers for Disease Control and Prevention, America's top doctor. For decades, the CDC was the gold standard, the first call when a new disease appeared. Their scientists were the calm, trusted experts who helped stop outbreaks and kept us safe. But now that calm voice is cracking. The CDC faces a crisis, not from a new virus but from within leadership turmoil, slashed funding and eroding trust. Imagine your family doctor replaced by someone who thinks crystals cure broken bones. That's the level of chaos. The CDC, once a global leader, is being dismantled from the inside. This isn't just America's problem. When the CDC falters, the world's defenses against disease weaken. Ministries worldwide rely on CDC guidance. Their research shapes global health policy. Without the CDC, the global safety net unravels. The systems that stop local outbreaks from becoming pandemics are at risk. It's like pulling the batteries from every smoke detector on the planet. The stakes, global health, and the question isn't if we'll feel the impact, but how bad it will be. The world can't afford a sick CDC. How did we get here? It started at the top. The White House fired CDC Director Dr. Susan Menarez after just a month, reportedly for refusing to endorse unscientific directives from Health Secretary Robert F. Kennedy Jr., a longtime vaccine skeptic. Her replacement? Jim O'Neill, a venture capitalist with no medical background who believes drugs only need to be proven safe, not effective. Science is now sidelined by politics and ideology. In protest, top CDC officials resigned. Heads of immunization, emerging diseases, and public health data all gone. Then came brutal cuts. By spring 2025, a quarter of CDC staff were fired, with hundreds more laid off. Key programs, lead poisoning prevention, environmental health, maternal and child health, were axed. Hundreds of millions in grants to state and local health departments vanished. These cuts gutted disease tracking, vaccination clinics, and outbreak response. It's like selling the fire trucks before a wildfire. The CDC is now a shell of its former self, stripped of expertise and resources. The new leadership seems hostile to the agency's mission. The world's most respected public health institution is being hollowed out. The experts are gone, the money is gone, and the mission is in jeopardy. The consequences are already unfolding. The CDC's collapse isn't just America's problem, it's a global threat. In 2025, the US withdrew from the World Health Organization and cut CDC ties, crippling global coordination. Major US-funded programs fighting HIV, malaria, and tuberculosis were canceled, risking millions of lives. Experts warn this could mean 14 million extra deaths by 2030. The CDC's instability means slower, weaker responses to outbreaks. During the 2014 Ebola crisis, the CDC sent over 1,000 experts to help. Now that's impossible. With staff gutted and global ties severed, the CDC can't lead in a crisis. Confusion and mistrust spread as countries lose a trusted source of guidance. A virus doesn't care about borders, and a fractured global health network is an open invitation for disaster. The world is left dangerously exposed. Public health runs on trust, and right now that trust is shattered. The CDC's leadership now promotes anti-vaccine views, replacing expert committees with skeptics and reviving debunked vaccine autism theories. Access to COVID vaccines for children is being cut. Misinformation is coming from the top, while real experts are pushed out. Losing leaders with decades of outbreak experience can't be fixed with a quick Google search. The CDC's credibility is eroding fast, and the world is watching. When science is replaced by politics, countries don't know what to believe. Confusion delays outbreak responses and undermines vaccination worldwide. We saw this in Samoa in 2019, where anti-vaccine misinformation led to a deadly measles outbreak. Now that same misinformation has a US government stamp of approval. Trust is hard to build, easy to destroy, and the CDC is destroying its own reputation. The result? A world less safe from disease. Misinformation spreads faster than any virus. Is it hopeless? No. The CDC can recover, but it needs urgent action. First, restore scientific leadership. Put experts, not ideologues, in charge. Insulate the agency from political interference. Commit to radical transparency. Explain the science, admit uncertainty, and fight misinformation. Reopen communication with the World Health Organization and global partners. Reverse staff cuts and restore essential programs. Invest in rebuilding expertise and public trust. A strong CDC is the best defense against pandemics. The world's doctor is sick, but with the right treatment it can heal. For everyone's sake, we must make sure it does.